Hello everyone, I'm Dr. Chris Sargent and welcome to our third webinar on our Hashimoto's Facebook group. And I've got the camera turned around properly this time so that what I write on the board will look appropriate. There you go, beginner stuff, you know, just learning. And thank you for letting me learn. And I've got a kind of an interesting, a little bit different take on than just talking about disease and treatment and diet and all those kind of things. I think it's really important for people and patients, mostly people in general, to understand that our medical community and our medical healthcare system, particularly in the United States, but as I've been doing some research, I found out that it's really worldwide, does not have an adequate amount of nutrition education. So that may seem appalling and surprising that your medical doctor never had a class in nutrition, but chances are that's true. And chances are also really good that he had a pharmaceutical education starting in his first year of medical school. So I want to talk a little bit about medical education and the disease orientation, how functional medicine and alternative practitioners, naturopaths, nutritionists tend to look at things just a little bit differently. I want to talk about big pharma because we all know that pharmaceuticals are necessary sometimes. I'm not completely anti-pharma, but I am anti-wow is the first thing we do. I'm against it being necessarily the first thing in a lot of lifestyle cases. I want to talk about the insurance industry just a little bit because this is another industry that's really impactful on your health, and you may not really realize how much it shapes what your doctor can and cannot do, which seems really wrong as well. So they have influences on them that you may or may not completely have an understanding of. And then also I want to talk at the end, I want to talk about root causes, because this is something that a lot of people ask about on the group. And actually we may start with root cause and medical education. That seems to be that'll group well together and get us going for the evening. The only problem with having my camera so that you can see the board properly is that I can't see your comments tonight. So I'm going to miss that piece until afterwards when I go back and look. Excuse me. So let's get started. Let's talk about medical education and disease orientation. So let's start here. And this is a graphic that I created on my own to help patients really understand why doctors don't really see everything that you feel like they should be seeing. I'm going to play with the light a bit and see if I can get it so that it hits the board a little better, but I guess it's just not gonna happen for us tonight. So I'll do my best and let's go. So basically, when I'm going to break this into three big columns. So I'll work on this so that everybody can see. And over here, I'm going to put the traditional MD. This is what you have been accustomed to. I'm not sure if you guys can see this or not. Maybe I need to move it closer. Let's move it a little closer. The traditional MD here, I'm going to move my light a little. Oh, I just love live TV, don't you? The traditional MD in this column, this is the column that you guys all fall into, right? This is the I feel like crap column. And you know what? I'll provide this in a written form for you because I did a little survey this week that says that some of you really like a written form. So we'll try to put this into some written form for you. This is the I feel like crap column. This is your traditional MD column. And this is the well column. This is wellness. And if we look at this as three distinct pools of people, we all at some point fit into this wellness column where we felt good and things were going well. And at some point we jumped into the I feel like crap column. And when doctors look at your labs, and this is really directed at laboratory medicine, but when doctors look at labs, and labs start falling out of this wellness column, which, you know, when you feel good, your labs should look good, right? But when you feel bad, they start falling out of wellness. And this is where the traditional medical doctor loses in his training. Because when you fall into this space right here, this is not a space that he or she is trained to see. So basically, they see this. They don't ever see anything past this one column. And so the MD only sees laboratory values when it crosses that big line right here. And they have a script or a scalpel to help with those values once they get there. So until then, they don't see anything, which is why you get told you're fine. It's all in your head, and you are demeaned for bringing anything else to their attention. So just understand that it's, and believe me, I'm not defending it. I just want you to know that it's because they were never really trained to see anything except what they can treat with their script or their scalpel. So what's different about the functional medicine doctor is we look at you as you should be well all the time. We want you in this wellness column all the time. And so if you escape in our labs, if you escape the wellness column, we have to bring you back. That's our job, is to keep you well. So you can see that there's a philosophical tug here at waiting for you to get sick before you get treated, because that's the way they're trained, versus, oh no, we need to stay well and keep our bodies well, just like you would keep a brand new shiny car healthy. So when you start to fall, when your labs fall just out of range, we go, whoa, wait a minute, something's going on. What have you been doing? What's different in your life that created these values? And so we identify the lifestyle factors where people might mess up sometimes. So those lifestyle factors include eating, drinking, moving, sleeping, thinking, and feeling. And all of those lifestyle factors are under your control. We can't always control what happens to us in the world, what people might do or say, or what gets forced upon us, but we can always choose what we eat, drink, how we move, how we sleep, how we think, and how we feel about any other situation. We can choose those feelings. So the lifestyle medicine piece of all this can clean up all of these laboratory values. So all of you ladies and men who are wondering whether lifestyle actually works, this is how it works. We gather up all of the lab values, even the ones that have fallen into the disease state, which some of you have Hashimoto's, hypothyroid, hyperthyroid, thyroid cancer. We find all of those things that have created that, eat, drink, move, sleep, think, and correct that, and then backfill your deficiencies. Zinc, selenium, vitamin D. I put this out there all the time, right? Zinc, vitamin D, selenium, vitamin A. What are you deficient in? B12, B complex, all of those basic things. So when you start to, for you Hashimoto's patients and people in our group, when you go gluten-free, dairy-free, egg-free, when you really start to clean up your diet, you do autoimmune paleo, or you do the renew thing that I have on there, or you use my eat for energy diet that's on there. Anytime you start one of those programs, you have eliminated some serious stressors that probably caused part of the I feel like crap. Processed food is the biggest one. High carbohydrate diets, starting your day with oatmeal, some of the worst things that you can do. And that starts the ball rolling down the I feel like crap syndrome. So hopefully that makes sense to you. Now I also want to talk about root cause, because Isabel Wentz's book is called Root Cause Hashimoto's, and let me get this off of here. And where does that whole root cause thing come from? And what does that mean to you? And how does that impact you? And how does it impact the way that you get treated? So just a minute here. Let me see if I can fix this just a little bit. Make this come up a little. So root cause really talks about how do our, sorry, I'll be back in a minute. How does our lifestyle impact how we feel? And our lifestyle can impact a lot of things. So let's go back to, this is our body down here. This is our body. And we have an immune system. We have GI, gastrointestinal, genitourinary, GU. We have the pulmonary system, or your lungs. We have, your immune system is directly located by your GI system, right? We have heart, we have your liver, we have kidneys, we have a pancreas, we have a spleen. We have all of these different organs inside of us to help our body. We have a brain. This is the big one, right, in the middle. So this is our body, right? We're all of these working parts, and they all work together. You can't separate them. They're all in one body. But when we're born, and we know now that when we're born with over 250 environmental toxins already in our body. I know, it's totally sad, right? You can't even go to the polar ice caps to get away from it. So our body has to figure out how to handle all of those things. So that's just part of our GI, our GU, our liver, our kidneys. Those are things that impact our health. And depending on where you live in the country, depending on whether you're a city or country, determines what type of toxins you may be exposed to. We also have food coming in, right? We talked a lot about food last week, and how our processed food, right? Processed food actually ends up as part of our toxins, and like high fat, high carbohydrate, low nutrient foods really end up impacting like a toxin, as opposed to something that can nutrify or fill the body up with goodness. So basically, processed food also creates another stressor called deficiencies. Because not only does it take vitamins to process the processed food, but you're also not getting any. So it's like a net negative, right? Does that make sense? Hopefully that makes sense. We also get hit with viruses. I'm just going to put a V. Bacteria, yeast or fungus, like Candida. We also get hit with this. These guys can create their own set of issues and may also cause the introduction of more toxins because of the use of antibiotics, or ABX. That's what you can see. So antibiotics and medications become toxins as well, right? Meds can also become toxins and start to really impact our body, again, in a negative way. What about the water you drink? Is it clean? Is it filtered? Is it alkaline? Does it have all the nutrients in the water, or do you just have toxins? Even a cheap filter is better than none. Chlorinated and fluoridated water can have a very big impact on your thyroid. So those are things that we have to really pay attention to when we're drinking water, and we want to make sure that that's clean. How about the way that you move or don't move? What if you're in a very sedentary job? They say that sitting is the new smoking, that it's so bad for us that even if we go to the gym for an hour a day, if we've sat straight for 8 hours, then an hour a day at the gym doesn't undo that. So we have to keep our bodies moving all the time. And then sleep. Sleep is also important. If you're not sleeping, you can't turn on your rest and repair systems. Those systems work at night to clean up whatever mess we've put into our body during the day, and to allow our brain to function like the rest of our brain to function, we shut off consciousness so that the rest of our brain can function, because we can't do all of that during the day. That's why sleep is so, so, so important. And then what other toxins we may also have, not just physical toxins, but what about the thoughts that we think, our thoughts? What about toxic feelings that we have? What about toxic people that are in our life creating more stress for us? Because these are all stresses, right? These are all can create stress in the body. And this is root cause medicine, is really understanding that it's not one thing that causes disease. Because your genetics also play a little role, about a 25 to 30% role. You are not doomed by your genetics. That's a whole other talk. So just understand that your health, someplace in here, created the problems that you have right now. Birth control is a huge piece. Infertility treatments, big piece to thyroid issues. I find deficiencies and antibiotics probably are the biggest cause of most of the disorders that I see in my office. So hopefully you understand a little bit more about root cause medicine, and doctors are not trained this way at all. They are only trained to wait until your labs cross the line and then either cut it out or give you some sort of medication to dampen the symptom, not cure the disease. That's why most drugs that they give you for lifestyle issues, you have to be on for the rest of your life. Like the drugs that they offer for a lot of autoimmune issues are big biologic drugs, but that dampen your immune system. But once you come off that drug, your immune system still works. It didn't fix the immune system problem. That's why what we eat, drink, how we move, sleep, think, and feel can help improve your immune system. There was a recent study that said one negative interaction with a human being can dampen your immune system and change it for up to 24 hours. So it's really important to understand that what we do affects everything in our body, what we think, how we feel, how we eat, drink, move, and sleep. So hopefully you understand a little bit more about root cause medicine. And then let's go ahead and talk a little bit about medical education. Medical education is, like I've said before, is not including enough nutrition. And interestingly, the medical schools have known this. I looked at articles over the last couple of weeks because I've almost finished the first chapter of my book is all about that. And basically about 20% of the medical schools even have a formal program. Most of the medical schools don't even have faculty dedicated to nutrition training. So they don't have programs, it's not organized. And most schools also are under the influence of pharmaceutical reps starting at the beginning stages. And so it's not necessarily the doctor's fault that they don't know it. It's the educational system that we have, and it's not just here. I looked at studies in Canada, I looked at studies in India where you'd think that it was a little bit more broad. They have some of the similar, but not as bad in Europe. They don't have as much pharmaceutical influence as they do here. Particularly in medical graduate education, like post-grad, continuing education. The statistics say about 30% are funded by pharmaceuticals here, and it's much less influence when you look at the Europeans. So please understand that in some of the surveys, like 500 different medical directors of graduate medical education programs were surveyed and 72 respond. So it's not like they don't know that there's a problem. They don't care that there's a problem. There's so many other things that are deeply rooted in the medical education system that are more important than implementing a nutrition program, it's barely on their radar, but they've known it for a very, very long time. And one of the things that you also need to understand about the medical profession as a whole, and I think I may have said this maybe in my first video, is that they don't change quickly. Even when the Dr. Lister found that hand washing created better infant mortality, it took them 20 years to implement that. And that's like, right? Crazy making, right? That just, okay, if we wash our hands, babies live better, and surgeries, people don't die so much. Like, that's crazy, but it took so long for things to happen. They've known since in the early 1930s and actually late 1800s that probiotics were going to be necessary if we introduce something that kills the bugs inside of us. And yet even today, now that was 80 years ago, even today, doctors will not, or 90 years ago, doctors will not even acknowledge, some doctors, that probiotics are necessary. So just understand that the change or the tide to shift medicine in general takes 30 to 50 years. And we're just not there yet. We're probably at 30 years. We're probably on the cusp of things starting to change, but we're not there yet. So looking at 700,000 medical doctors and probably maybe 20 or 30,000 functional medicine practitioners. There's about 50 or 60,000 chiropractors out there. So we're not a very big group that do this kind of medicine compared to the traditional MD and the specialists. So let's talk about big pharma, because they also influence, like I said, they influence medical education, right? And it's really well known, and there was a lot of studies and a lot of brouhaha about back in 2009 about how many spiffs they were giving, or like gifts, and how much they were paying people. Well, Time Magazine also had a big article, and Harvard, of all the medical schools, got an F, basically, because they had about a third of their doctors and professors and instructors are on the pharmaceutical dole. They were taking hundreds of thousands of dollars from the pharmaceutical company, and they're the professors in the medical schools. So yes, it's disgusting. And this is how pharma gets into the heads of doctors. I was speaking to a doctor the other day that they even, as residents, they still have hope that they get to treat the whole person, but by the time their residencies are done, most of them are just like whatever, and they just do what they're told to do. So it's passed down, and it's passed down through a very antiquated system. They still make residents stay up for hours on end and have 48-hour shifts and some of these crazy making things that doctors can't make good judgments on that, and they just get beat down during the residency that they have to conform, and that's what they're told. And so the pharmaceutical reps actually have up to 4 visits with residencies a month. That's once a week. So these residents are getting pelted by pharmaceuticals all the time. Emergency room docs get them in here all the time. So that's just some of the research that I had found out. So yeah, it's pretty disgusting about how big pharma is. $14 billion spent every year, and these are older statistics, on just marketing to doctors. It's like $8,000 per doctor. So giving samples and cups and pens and all that kind of stuff, not to mention the fact that a lot of them do make extra money when they prescribe, and they also have to. So here's where insurance companies, the American Medical Association, other associations also come into play. Doctors are held to a standard of care, and that standard of care gets shifted and changed by a lot of insurance companies, by the medical schools, and by the AMA. They put out standards of care. A lot of the other associations, like specialty associations, also put out gold standards of care, which is why you have to have an x-ray before you have an MRI or a CT. And some of those things make sense, because it doesn't make sense to go in with the most expensive test first if something else can illuminate what we need to. That's why they go in with an ultrasound on your thyroid when they can feel the nodule. And so why don't they just biopsy it? Well, first of all, you have to locate it, but why don't they just do an MRI of your whole body and make sure that everything's fine? Because it's expensive. So some of those standards make sense, but some of them don't. And some of the things that really impact you as Hashimoto's or hypothyroid really impact you because a lot of the tests that we need to have done, the T3s, free T3, total T3, T3 uptake, those kind of things are not part of the standard of care. I know. I get it. I hear your heads, but just like, it's not part of their standard of care, partially because they don't have a drug to fill it. If they find that you're low, they do actually. If they find that you're low in T3, they can give you Cytomel, or they could put you on a natural desiccated thyroid. But most of them don't have the continuing education, or they're on the dole of Synthroid companies. So just understand that I had a patient in, my last new patient of the evening told me that. Basically, her endocrinologist told her, this is what I do. I give Synthroid, I don't do anything else. The patient had to force her to get antibodies done, and then she wouldn't do both of them, to get a reverse T3 and free T3. I mean, it's crazy that you have to force your own doctor. That's why it's titled, like, yes, you do know more than your doctor. You are not crazy. Because these doctors just don't know. Their pharmaceutical companies are their chief continuing ed. Remember I told you that they pump up the continuing ed, and so if they're not in a seminar that says, oh look, you need to give this, this, and this, then they aren't learning it, and they don't know nutrition on top of it. So just understand that the standards of care aren't set by your doctors. They're set by insurance companies, the AMA, a little bit by pharmaceuticals. And doctors can lose their license, medical doctors in particular, and doctors of osteopathy, DOs, can lose their license in certain states and have lost their license when they practice outside of their scope of practice or outside of their standards of care. Not only that, but the big insurance companies can come in and audit these doctors. And if they find that they're doing lifestyle medicine, a lot of these doctors are losing their ability to practice insurance, or to use insurance in their practice. So understand, again, the doctors get stuck and the patients get stuck. I call it the insurance squeeze, because what happens in that scenario is the doctor loses, the patient loses, and there's no way for any of that to win. That's why, and insurance companies don't typically pay for what we do. They literally don't think that eating vegetables, taking in nutrition, making sure a patient sleeps good, eats right, eat, drink, move, sleep, think, feel, that they don't think that that's medically necessary for a patient to be told that is something that they should just know. And we don't have that type of healthcare system where that kind of education is given, because schools also, right, the standard of care floats down to schools, floats down through your legislature, and we get things like in certain states, vaccination laws where vaccinations are absolutely necessary. And we can go round and round about what you want to do about that, and it doesn't make any difference to me. There is no judgment whether you vaccinate or don't vaccinate, but just understand that, and that's not what we're talking about here, but what we're talking about is standards of care and how they get filtered through the entire huge system, and they land on you like in demeaning and dismissive attitudes. And so, yes, it's frustrating. I feel you every time I hear or read one of those stories in our group. But just understand that your doctors have these crazy, they can get audited, they have these crazy standards of care, and they can lose their license when they practice outside of what their norm. So I hope that you understand that you do know more than your doctor, and you are not crazy. You're not. Just keep plugging away and know that there are functional medicine doctors available for you. I'm available. Functionalmedicine.org has all of the functional medicine practitioners that have been through the Institute of Functional Medicine. The Institute was started about 30 years ago. I'll give you a little bit of functional medicine history here. Was started about 30 years ago. I've been in practice for 25. I found functional medicine when I was in chiropractic school, so we're looking at 28 years ago, when it was in its infancy. And so I've grown up doing functional medicine, and I didn't understand that I was doing functional medicine when my mom taught me how to eat and how to cook and how to do it. A college friend of mine taught me how to do detoxes, and then I went to chiropractic school. And so I've been in this journey and in this world longer than than I can even imagine. I don't even want to think about it. So I started down this chiropractic path because I got so mistreated by medical doctors. So I understand what you're going through. And I know it's crazy making. Believe me, I live it. And it's crazy making to me too. So I hope that this has been helpful, and just understand that there are people out there that know what they're doing and excuse me, can help you figure out what's going on with you. But you're not crazy. You do know more than your doctor. So have a good evening. Good night.